August is the month for women in South Africa, and as President Jacob Zuma took to the podium to address thousands of delegates who turned up for an international conference for the African Union on maternal, newborn and child health in Africa, he said the timing was right.
We all recognize the importance of women's health as well as children's health in the development of our nations.
The African Union conference was to discuss a way of putting a stop to the frequent maternal and child deaths on the continent.
Under the theme, no woman should die while giving life, we launched KAMA, the campaign on accelerated reduction of maternal and child mortality in Africa.
Rightly so, because the deaths are alarming. Africa has the world's highest mortality ratios at 429 deaths per 100,000.
You are aware of Uganda's situation. Currently, the statistics indicate that 438 mothers out of every 100,000 die while giving birth. And I think all the causes of death are actually preventable.
Zuma asked the continent's leaders to ensure that no woman continues to die in childbirth. UNFPA's executive director asked different countries to take into consideration the achievement of UN Millennium Development Goal number 5A and B of reducing by 3/4 the maternal mortality ratio and achieving universal access to reproductive health.
Please make sure that when you get back, you ensure that you can reach a pregnant woman, you can prevent unwanted pregnancies, you can provide family planning, and you can make sure that a pregnant woman can deliver safely.
UNFPA in Uganda is supporting the Minister of Health and the whole government in promoting maternal health by training health workers. We provide resources for training midwives, and then we support the government in equipping health centers.
Dr. Jotham Musenguzi, speaking on behalf of the civil society organizations, called on governments to prioritize increased investment in the health of women and children.
The women of Africa deliver children for the continent. We need to deliver for them.
The African Union Commission chairperson, Dr. Kosanzana Zuma, could not agree more, saying the deaths can be avoided.
The cause of this include lack of just access to proper prenatal care, lack of access to facilities during childbirth, inadequately trained or few trained health personnel.
In South Africa's case, the 3 H's are the most contributors to the deaths.
HIV, hypertension, hemorrhage. Both hypertension and hemorrhage can be dealt with if we improve our healthcare systems.
Also considered key in reducing maternal mortality is empowering the girl child with education, including sexuality education, to enable her make the right reproductive health choices. Florence Alimba, NTV, Johannesburg.